Okay, this video is general anesthesia and cognitive decline. This came out of a couple directions. I was reading a lot about mitochondrial inhibitors, and it's pretty routine that inhalational general anesthetics like isoflurane, sevoflurane, they'll inhibit complex 1. They put the patient to sleep and they make the patient unconscious, and the patient doesn't remember. And a lot of things about that are kind of interesting. Nick Lane, who writes a lot about mitochondria, was talking about how the patient becomes unconscious. Okay, so is that the seat of consciousness, mitochondrial function? When you start reading these papers about it, you see kind of results a little bit all over the place. Some say yes, definitely, general anesthesia, especially in older people, increases the risk of cognitive decline. Other ones say, oh no, not so much. And you have to remember, a lot of this stuff is being written in, they're written in medical journals, in anesthesia journals. They're not going to come out and say that their medication stinks. No journal is going to do that. Let's just look at a few things here. Cognitive decline in anesthesia with surgery in older patients. According to one study of non-cardiac surgery, a covert, that means unclinically recognized initially stroke, occurred in 7% of patients who are over age 65. There was increased risk of postoperative delirium, confusion, and long-term deficits. Another thing here about in patients over 65, about 65% experience some delirium, and 10% long-term cognitive decline after non-cardiac surgery. So, it's a little bit hard to make sense out of all that, but I've seen patients have problems after anesthesia, older patients. Most don't. Most patients come through it quite well. But, the healthier you are, the more likely you're going to come through it well. There's a lot of variables. How well tuned up is the patient before the surgery? Do they have problems with their hypertension, their diabetes, their sleep disorder? There's all kinds of things. There's psychological issues, depression, schizophrenia, bipolar, etc. There could be medication side effects. They could already be on a mitochondrial inhibitor, and then these general anesthetics, make it worse. They could have alcohol withdrawal. There's tons of variables in a surgical patient. And a lot of it is that these are people that are quite often very old and very frail. So it's no walk in the park. Okay, a couple things that are interesting here. This is talking about what do the anesthetics do. Well, first of all, I mentioned the bad thing. And then they also do some good things. Here's the bad thing, that volatile anesthetics like your isoflurane, they can increase mitochondria damage. They typically inhibit complex 1 of intermitochondrial membrane electron transport, and they can activate the mitochondrial apoptosis pathway. That means kill the cell, okay? By inhibiting complex 1, it can lead to a cascade of reactions causing the release cytochrome C. It'll exit from the intermitochondrial membrane through the intramembranous space across the outer mitochondrial membrane, and then activate something called an apoptosome to tell the cell to die. Okay, so you don't want that. But they also do some counteracting things. Okay, this is published in Journal of Anesthesia. They're not going to publish in Journal of Anesthesia that our anesthetics are all bad. I'm going to get to Nick Lane's paper last, and that'll tell you some interesting things. So the general anesthetic simultaneously, besides just damaging the mitochondria, it also did some good things. It would increase the activation of GABA, and that's an inhibitory neurotransmitter to let chloride into the cell, to hyperpolarize the cell, make it more negative, farther away from zero potential. They would also inhibit the NMDA channel. That's the channel to which glutamate binds and which allows calcium into the cell. And that's good because that means it's turning down the cell's activity, just like GABA would, to decrease the amount of calcium entry into the cell, to decrease the likelihood of it going into apoptosis. But you're still playing a dangerous game. Now, if you really need the surgery, that's good. But in my experience, a lot of people go for surgery they don't really need. A lot of women go for cosmetic surgery to get breast implants, which I think is kind of stupid. You don't need breast implants. A guy's either attracted to you or he's not. I don't think breast implants really matter that much. I think also, a lot of women go for surgery for nose jobs, for facelifts, all this cosmetic stuff. And that's not really necessary, and you're risking your brain. Just eat a low-fat vegan diet. You'll be skinny. You'll have good good blood perfusion in your skin. Will make you look good, youthful. Exercise. be nice to the guy. Well, men we're not that complicated. We want you to cook for us, okay? We want you to be nice to us. We don't want you to nag us too much, okay? We want a lot less from you than you want from us. Okay, next paper. All right, dementia risk after elective surgery, depending on the route of anesthesia. They had the highest incidence of dementia with the inhalational general anesthetics. Second to that was intravenous general anesthetics. And third to that was regional, which might mean, local anesthetic or spinal or something anesthetic. Okay, here's Nick Lane, and Nick Lane's a pretty interesting guy. He writes a lot about mitochondria. He wrote 3 books related to mitochondria. The first one was called Oxygen, and the second one was called Power, Sex, Suicide, and Mitochondria, and the third one is called Transform. It's all about mitochondria. I've bought them and read them and listened to all of them, okay? You're looking right there at about 45 hours of information about mitochondria. He's an origin of life researcher, so he does talk quite a bit about bacteria, which sometimes can get kind of boring, but at the same time, it's a little bit interesting. And he does exaggerate what they can do with prebiotic geologic chemistry with regard to origin of life. But I still like him because he's real smart and he's actually trying to solve things. And of course he's biased in his own direction. Everybody is, and he has to be that way to get funding. But he's still really smart, and he does explain some things quite well. And he does dig around and try to find out a lot of interesting things about mitochondria. So here's one point he makes. Anesthetics have no structural motif in common beyond lipid solubility, but they all exert the same effect. So whenever you see that's a strange statement to make, that they don't seem to have one chemical property in common. And he thinks they're doing something like changing the spin of electrons in electron transport in complex 1, which is a strange thing to say. But that's why you can get things like an inert gas like xenon to also be a general anesthetic. And he says that the volatile anesthetics, those that are liquid at room temperature but can be converted to a gas for inhalational anesthesia, they specifically disrupt complex 1 of intermitochondrial membrane electron transport. And he did his experiment then in the fruit fly, Drosophila melanogaster, which is a very common type of experimental model. The anesthetic simultaneously will increase mitochondrial membrane potential, implying that they're probably reversing ATP synthase, getting it to pump more protons into the matrix, which again is a strange thing. Okay, and they use this magnesium fluorescent, green fluorescent dye. Again, they thought they were getting ATP synthase pumping protons into the intramembranous space with a raised membrane potential, especially isoflurane. So anyways, this is interesting, okay? This is interesting, this idea that they're, number one, inhibiting the mitochondria. That's a scary thing, the idea of having your mitochondria inhibited. Number two, the fact that he thinks it's related to consciousness. I thought that was quite interesting. So my attitude, I've never had to have surgery. I'm 61 years old. I never had a surgery in my life, and I would definitely try to avoid it if I could at all possible. Sometimes you might need surgery. It might save your life. You got a ruptured appendix, but if you're a plant eater, you're probably never going to have ruptured appendicitis or diverticulitis. Some cancers, maybe. Can you get it done? If I could get it done with local, I'd get it done with local. My mom had died of colon cancer, so I went and got a colonoscopy, and I went and I had it with no anesthetic, none whatsoever. And, that way I would maintain consciousness. I was afraid that it might have a negative effect on my brain, on my memory. Of course, my family thought that was funny and said, "Oh, you enjoyed the colonoscopy. That's why you didn't want anesthesia." I said, "No, because I'm scared of the medications." So anyways, that would be pretty much my attitude in general. If you can avoid surgery, like why go for open heart coronary artery disease CABG surgery for a cardiac bypass to the coronary arteries when you can just cure the disease with a low-fat vegan diet? Low-fat vegan, no-oil diet. You're very unlikely to ever you're much less likely to have cancer or metastatic cancer and all that. Anyways, I hope you found that interesting and helpful. Nick Lane has a good lecture on the internet about anesthetics and mitochondria. So anyways, hope you enjoyed that.